are moving on to our segment on getting the data and publishing with the SEER Medicare data. Thank you for sticking with us. If you have made it this far and believe that the SEER Medicare data are the resource for you, this next segment will give you an overview of the process for requesting and accessing the data through NCI. This is really a key slide, and if you can make it through this slide and check each of the boxes, then this is going to be the data set for you. So before requesting the SEER Medicare data, there are a number of things you need to consider. First of all, the number one thing is that the data must be used to answer a research question, and we'll get into why that is in a minute. Additionally, each request for SEER Medicare data is project specific. You don't just submit a request to NCI and say, I'd like to request the data set. I'm just going to study a number of different things. You need to pre-specify your questions and outline the parameters for those questions. Additionally, you may only use the files to work on a project as it is described in your proposal. If you decide to expand your scope or add additional research questions, you're required to resubmit your application to NCI for approval. Further, no investigator can request the entire SEER Medicare data set. You can't go to NCI and say, I'd like all cancers, all years, and all files. It's not an option. Additionally, the SEER Medicare data are not released outside of the U.S. The data are restricted to those that reside within the U.S. This is a key point. Data are not immediately available. If you need the data next week to submit an abstract, this is not the data source for you. The approval timeline is approximately 3 to 5 weeks after submission for regular research requests. If you need to request restricted variables, and we'll get into which of those variables are restricted in a moment, that will require an approval period of approximately 8 to 10 weeks. In addition, once your project is approved, there will be an additional 3 to 5 weeks for data processing before you'll receive your actual data set. Once you have decided that the SEER Medicare data are the right data source for you, there are going to be 3 required documents that you will submit to NCI to request the data. The first is the application form. You'll also submit a signed data use agreement, as well as an institutional review board approval letter along with your application. If you are requesting restricted variables, you'll also submit an additional Form 4 that request that outlines the need for those variables. We've put together a set of tips to help you successfully complete your application based on requirements and feedback from NCI. So let's just go through some of the main components of the application.
People are having a hard time hearing you.
Is it better? Okay. I'll try and speak up. It said that you guys were having a hard time hearing, so I apologize. When you begin your application, your first step will be to go to the SEER Medicare website. On that, there is a tab for requesting the data where these Word documents are available for download. Within the document, the first section of the application is for contact information. There's often a confusion about who can be listed as the contact. There must be a principal investigator associated with the project, and that is the person responsible for the appropriate acquisition, use, publishing, and destruction of the data upon the project completion. Students and fellows are not allowed to be listed as a PI, so this is typically a faculty member, a permanent research staff that would be listed as the PI. You are allowed to list assistants, fellows, and students as an alternate contact, and those individuals then would receive the project-related correspondence if that helps for your project management. The second section includes a project title and an overview, and there's a few key areas here that could hold up potentially hold up your application. So you'll provide overall a brief overview of the proposed project. The key here is that you must pose a research question. And why is that? The data are released for research purposes under HIPAA. And HIPAA does allow for healthcare data to be released for research purposes as long as it describes a research question to be answered. So you must be creating generalizable knowledge. Let's go through a few examples. So if you were studying a research question, the research question could potentially be, I'd like to study the association between receipt of a new chemotherapy and survival. Or I'd like to understand the role of a new policy or a new payment model on outcomes for individuals with colon cancer. Those would be acceptable uses of the data and purposes for requesting the data. Alternatively, the following questions would not be acceptable and would not be considered research. If you want to show how a use of a procedure varies by geography, or just to develop an algorithm to classify complications, or just to develop a tool, that does not meet the requirements for research or the development of generalizable knowledge and would not be approved by NCI. The next section that researchers are required to complete is outlining the cancer sites that they will be requesting. As you saw earlier, no researcher is allowed to request all cancer sites. And as you're considering your set of research questions for your project, we ask that you consider, and NCI asks that you consider the minimum data necessary rule when selecting cancer sites. And what this rule requires is that you limit the use or disclosure of and request for protected health information to the minimum data necessary to accomplish the intended purpose of the research. So you only request the cancer sites that are necessary to answer a research question. If you're interested in breast cancer related questions, requesting breast, colon, and lung may not be appropriate for your research request. Oftentimes researchers may be interested in cancer more as an outcome, or just general patterns of cancer care across the U.S. In this case, NCI would recommend considering that researchers request either the top 3 to 5 most common cancers, or consider requesting the 5% all cancer diagnosis file. So those were the cancer cases we discussed earlier that include the cancer cases within the 5% sample of Medicare beneficiaries. The description of the project should be brief. It should be no more than 5 pages total, and consider how you might present a brief proposal for a research project. Overall, you'll need to provide a brief background or motivation for the project. If you already have a funded project from an external agency, you can reuse a lot of that information. Make sure here that you'll restate each of your research questions to be answered, and briefly describe each of the key inclusion or exclusion criteria for your study. You may consider going back to Christy's discussion of creating your cohort and describe some of the common criteria you envision using to create a cohort of individuals who, as an example, may be likely to have complete claims, including restricting by cancer site, age of diagnosis, considering Part A and B enrollment, as well as managed care enrollment, and diagnosis at autopsy or death certificate. Once you've described how your cohort will be created, you'll need to describe all planned covariates or outcomes you plan to evaluate in your analyses, as well as an overview at a high level of how you plan to define them. This helps NCI to determine whether or not your planned analyses are feasible and possible within the SEER Medicare data. Specifically, to the extent that you're able, list the codes that you plan to use, as well as the definitions of the covariates or outcomes of interest as a primary outcome or measure within your study. As an example, you may say chemotherapy will be measured as the presence of a claim using these particular CPT codes within X months of diagnosis, and will be using these specific files. You may consider going back and referencing the treatment module earlier today as a way to get started. One of the ways researchers often submit their request is to just create a set of tables that outline these high-level measures and the primary measures for their analyses. Some helpful resources to get you started, and we've mentioned these throughout the day. The SEER Medicare website has a wealth of information on measures for cancer treatment, covariates, and other measures of interest. Additionally, you may consider going into PubMed to see what other researchers have done in the past as a way to create their own measures. And finally, there was a special issue back in 2002 published in Medicare that provided an overview of the SEER Medicare data. And this special issue provides good overviews of potential codes you might consider to get started as well for each of the different cancer treatments of interest. One thing to remember, as we've highlighted throughout the course today, is that there are a number of measures that are not reliable or are not available within the SEER Medicare data. These may include cancer recurrence, information on physiology such as blood pressure, pulse, BMI, the results of tests such as lipid panels or pathology reports, as well as underreporting of behavioral information such as smoking or alcohol use or exercise. There's a nice summary on the NCI website of measures that are limited or not available in the SEER Medicare data, so we would encourage you to go to that site and review prior to submitting your application. In addition to all of your covariates and the description of your cohort, you will need to provide an explanation and justification for every file that you plan to request within the SEER Medicare data. The data are not just delivered as a single data set to researchers. You need to justify each of the files that you'll need and why you need them in order to complete your analyses. As an example, you might say, I need the PEDSEF file to be used to identify patient demographics, to identify my inclusion and exclusion criteria. I'll also use the MedPAR file, and I will use that to determine cancer surgery and rehospitalizations as part of my outcomes for the study. After that, you'll describe a short description of your planned statistical analyses. The reason we include this is to ensure that you may not run into issues related to sample size, and we'll get into that in a moment. But this can be very high level, such as we'll use chi-square analyses and t-tests to examine on the outcomes of interest. NCI also requires that you'll list all of the personnel that will be involved in the study. This cannot include personnel to be named. You can always go back and update your project should you add or remove project staff throughout the project period. You should include all individuals who have access to individual level data, so the claims level data. If they're only accessing aggregate data, they would not need to be listed on the project. You'll also need to list the institutional affiliation for each individual, as well as a timeline. This is really to help NCI gauge whether or not the study period is reasonable, given that the data are very complex. So please be realistic. Doing a complete analysis and trying to publish within a few weeks is likely not feasible, given the complexity and time required to do the analysis and create these measures. The next section is where researchers will tell NCI how the data will be stored and what protections will be in place to ensure that they are not accidentally disclosed. So in this section, you'll report on the specific location of the data and where and how it will be stored. As an example, you might say that you would store your data on a password-protected, encrypted departmental server and describe where it's located and who has access to it. One key point from this that cannot be emphasized enough is that NCI does not allow cloud storage of the data. Requests that are submitted with cloud storage as an option for data storage will not be approved. You'll also need to detail how the data will be protected from unauthorized access. such as locking it in the PI's office. And then you'll need to address two specific assurances. One, that no attempt will be made to identify individual patients, hospitals, or physicians. And two, that all publications, presentations of the data will not allow identification of individual patients, hospitals, or physicians. And we'll talk about how that happens in a few minutes. Finally, there's the funding source, which is required for all applications. You can state that there is no external funding source. However, if the funding source is a for-profit company, such as a consulting firm, a funding letter is required that states that the PI is free to work and publish the findings without limitation by the funder, and it must come from a person in authority on their company letterhead. As I mentioned before, there's a number of restricted variables that require additional approvals in addition to the primary application that a researcher would submit to NCI. These include the actual patient and provider and geographic identifiers. The hospital identifiers. Most researchers do not actually need access to the true identifiers in the data in order to complete their analyses. They're all encrypted in the same way across all files. So if all you need to do is to understand volume or to link by a unique provider across the files, you would not need to request restricted variables. You could do this analysis using the data as it is without requesting special permission for unencrypted variables. This does apply as well to the census tract and the zip code files. Those are separate files that have been created that you can link to patient and claims-based information to understand more about the geographic characteristics of the populations of interest. However, if you do need to have the actual identifiers, researchers can request the actual census tract or zip code of the patient, physician, or hospital, as well as hospital provider numbers. There are also a number of SEER-specific variables that can be requested with additional permissions, such as Oncotype DX. However, one caveat is that unencrypted physician numbers are not available for request. Those will always remain encrypted in the data source. Finally, if you plan to link the SEER Medicare data with any other data source to conduct your analyses, you need to list that and specify that in your application. Doing so without approval is a violation of your data use agreement. Any request for restricted variables will add time to the request process because it does require approval from all of the SEER individual PIs, and so just plan for that in your timeline for your research project. There is a separate section where you list the data files that you're requesting, as well as the years you'll need. So you'll need to make sure that those are consistent between and across the entire proposal. That's one thing that can hold up investigators if there isn't consistency in the files that are requested across the application. So double check that the files listed here match your proposed cohort description, as well as your description of how you'll create your covariates and your outcome measures. Also consider that you may need, depending on your research question, to obtain pre-diagnosis information about individuals, and so you'll need to account for that in which data years you'll be requesting. So let's say, for an example, you would like to request breast cancer diagnoses from 2005 to 2010, but you would like to understand comorbidities as well as their outcomes, at least 1 year diagnosis. You would need to request data beginning in 2004, so you would have those claims in the year prior to diagnosis through 2011. So for those individuals diagnosed in 2010, you would have at least information on their care 1 year post-diagnosis. So make sure that you consider that as you list out your requested years and files. So that covers the primary application. In addition to that, you'll be submitting a signed data use agreement. One thing that we always emphasize, and NCI emphasizes, is that you read the entire document so that you know what you're agreeing to. Some of the key points researchers do agree to by signing the data use agreement are: 1, that you will not be using data for a purpose outside of that proposed research that NCI approves. You are not allowed to share the data with other investigators. You must also notify NCI if you do move to another institution. There are processes for that. And also that you are appropriately securing your data. You identify in your application how and where you'll be storing it, and that needs to be consistent with how you do actually store your data. And then finally, that you'll be submitting all manuscripts and publications prior to submission. We'll cover how to do that in just a moment. Finally, you'll submit an institutional review board approval. One key point here is that your study title and the PI listed on the IRB documents you submit to NCI must match the study proposal that are submitted, so the titles have to match. One thing to consider is that many IRBs, including the NIH's Office of Human Subjects Research, have determined that the SEER Medicare data are exempt. There are a number of resources on the SEER Medicare website that you can provide to your IRB during the review process that can provide them more information about the types of information that are included in the data to help them make that determination. And then finally, the top 5 reasons a SEER Medicare application is not approved. Let's go through each of these, and you can make sure that you check each of these off as you are submitting your application. First, the central purpose of the study is not cancer research. Make sure that your application is. Second, the proposed research involves data that may compromise the privacy or confidentiality of patients, providers, or institutions. Consider when you're planning your analyses, how detailed and what level of aggregation you'll be considering. If there's a concern that you may be able to re-identify patients or individuals, that application may not be approved. Additionally, if the research question is not sufficiently detailed to determine if the proposed analysis is feasible, it will be sent back to the researcher for more information. 4, if the SEER Medicare data are not of sufficient quality or completeness to provide accurate data to address a specific research question. And finally, a missing application component, such as an unclear description of key variables or incomplete discussion of files and how they'll be used, or inconsistency. Now that you have successfully navigated your submission of the data request to NCI and received your data, you'll go through and you'll conduct your analyses and be ready to submit a manuscript for publication. Let's go through some helpful tips for publishing and using the SEER Medicare data. Remember, after reading your DUA, you'll notice that prior to submission, PIs are required to submit every publication to NCI for approval before it's sent off to a journal. The purpose of this review is not peer review. NCI will not go through and say, we're concerned about your methods, we don't think that this is clear. The publications are reviewed for the 3 following criteria. First, that your findings will adhere to the SEER Medicare data release policies. And you'll see that within your data use agreement. Secondly, that your submitted publications are consistent with the work that you proposed in your application. So it's just focused on are you publishing on research that's consistent with the questions you posed in your application as well as the measures you describe. And third, that investigators do not report findings in which the cell size is less than 11. This is really the key reason why manuscripts are returned to investigators from NCI, because the manner in which they're submitted would violate CMS's policy for cell size suppression. We'll go through what that means next. So how, as an investigator, do you adhere to the cell size suppression policy? The policy states that no cell, so this would be a cell size for a number of admissions or discharges or patients or services, can contain a value of 1 to 10. You cannot report that directly on the data. However, a value of 0 does not violate the minimum cell size policy. You can report cell sizes such as there are fewer than 11 patients that have had this event, or there are fewer than 11 patients that had this treatment. For SEER Medicare data, this applies to reporting of information on patients, providers, as well as hospitals. So you'll need to consider that in your tables and cell sizes. The purpose of this is to protect the confidentiality of Medicare and Medicaid beneficiaries as well as providers. There's an extensive list of other examples for how you can adhere to the cell size suppression policy that you can find through the link on this slide. So overall, some final thoughts. We, as well as NCI, are very happy to help as you go through this process. There's a lot of information to synthesize, so feel free to submit any questions you have about requesting the data or understanding the SEER Medicare files all the way through publication, and you can submit them through the SEER Medicare contact. Again, the link is listed on this slide. And with that, I think we have a few minutes for questions.
All right. So one person had a question about the IMS extraction. They said, will the Medicare population always be a subset of the SEER population, or can data extraction yield Medicare files, including subjects not residing in the SEER area? Sorry, I had the chance to read the question. Helen didn't. So I think what the question is asking is whether or not the extraction can be done using, for example, diagnosis codes on the Medicare files, and it is not done that way. It is done using the SEER definition of the cancer site. So yes, the Medicare population will always be a subset of the SEER, or actually it's everybody that is in both. Yes. One other question, if I have questions as I am preparing my application, what should I do?
Well, that's a great question. You can go here to the SEER Medicare contact. It's listed, if you go and you search for NCI and SEER Medicare, there is a link on their page to the SEER Medicare contact, and they make sure that your questions get to the appropriate person at NCI to make sure that those questions are answered.
And where do I go to get the forms for a DUA request?
Yes, again, for the forms, you will go directly to NCI's website. They have a page dedicated to the SEER Medicare data, which provides an overview of the data, a description and documentation of all of the data files, as well as all of the request documents to access the data.
And then finally, do I need to submit an exempt IRB approval? Does that need to be included with my application proposal?
Yes, so the question was if you need to directly submit your IRB along with the application, and the answer to that is yes. You will submit your approved IRB form along with your application.
And then I guess the final question is, what are the fees associated with getting SEER Medicare data?
Another good question. There is a cost calculator on the SEER Medicare website. Oh my gosh, I'm sorry, I apologize. For some reason our speaker button was bumped, and so everyone has probably not been able to hear me very well. I apologize. One of the things you can do is to go onto the SEER Medicare website and go onto the cost calculator that it is listed on there to review, and you can kind of do a back of the envelope calculation of if you have a specific set of years you're interested in, and specific cancer sites, it'll help you to calculate what the cost would be.
One other question, if the PI leaves the organization, could the organization still keep the data and continue with the proposed research project?
That is an option. You are able to switch the PI of a project.
And I think that's about what we can answer for this segment.
Okay. Again, I apologize that we had some apparently technical difficulties with the volume of that last segment, but hopefully if you review the slides and still have remaining questions, we would be happy to either have NCI or ourselves answer the questions for you. Okay. So with that, I think we are going to take just a brief pause and reset for our final segment of the day.